Frozen though. You're in what? All right, I've got you back.
Am I back?
Yeah,
Yeah.
you're good.
I think we're recording, right? Okay, let's go. Right, well, today we're talking to Amy. Now, before we talk about where you are, Amy, you do look vaguely familiar. Did I teach you for 3 years or something?
Yes, you did. And I have your book as well. I have your book. I keep it at work. It's like a Bible.
So, Amy's one of the students I'm very proud of. And where are you, Amy?
I'm in sunny Barbados.
You are, yeah. And what temperature is it there now?
Hot.
Like proper
It's
hot, like.
probably about 32 degrees, and at the
Yeah,
moment, it is 9:15 in the morning for me, and it is
yeah,
bright sunshine. I was actually going to
yeah.
film with the sunshine, but it's too bright. I've had to close the curtain.
Okay, right, yeah. So it's the hot time of year, isn't it? Yeah.
It
And
is, yeah.
you still you're working as a nurse now in Barbados, Amy, aren't you?
Absolutely, yeah. Yeah, I'm head nurse where I work. I work in interventional radiology and cardiology. Yeah.
Yep. So give us a sort of background of the pandemic so far in Barbados, Amy. I mean, last year you were doing pretty well, really, weren't you?
Hmm.
There was low cases. What's the background there?
All right. So we basically started getting cases around March last year. We've gone through two lockdowns since then. Um, Obviously, being an island, our cases were imported.
Hmm.
So we actually closed our borders entirely for a period of time. Obviously, that had the economic impact for us, especially with tourism, because tourism is a massive element of our
Hmm.
income.
Hmm.
But we felt we had to do it for the safety of the population.
Sure.
So we had a lockdown last year, and then we had a spike in cases again just after Christmas, between Christmas and New Year. And we ended up with another lockdown in January. So it was a difficult time.
And have the cases been going up just lately since
Yeah,
2021?
we were very low. We were getting very low cases, one to two a day. And that was it up until it would be about 3 weeks ago. And then we had a spike in cases.
Right.
And since then we have seen a gradual increase, but then the last couple of days it's been a decrease again. Um, I believe yesterday was 6 cases and 1,500 tests being done. Um, it's due to some small clusters.
Right.
We
Right.
do very intense contact tracing over here, and I think how we handle it is actually very different to many other places. Anybody that is a positive case has to go into supervised isolation. You cannot isolate at home.
Oh, right.
So
Wow. Wow. Yeah.
yeah,
Yeah.
once you are a positive case, we actually have government facilities. Um, Harrison Point was an old naval base.
Yeah.
It's been completely transformed, has an ICU, it has full equipped out there. And basically, persons go up there to be assessed. If they are asymptomatic and well, there are other facilities that they can be transferred to, regulated by the government. We have a COVID team,
But they're fully
and
supervised during that quarantine period.
fully supervised,
Right.
and persons are still having their vital signs taken and everything, even if they are asymptomatic.
Mm-hmm.
um, but then if you need some more care, be it oxygen, or there's some kind of concern, or you have underlying diseases that could pose a problem,
Yeah.
or if you need CPAP or ICU, they have all of that facility up at Harrison Point, and that's where you remain until you are cleared.
And has the healthcare capacity there been sufficient for the number of patients that have been coming in?
Yes. So last year was far more difficult than now. We had so many cases, and we had
Mm.
so many very sick cases.
Mm.
Um, but we found that has really eased off now. Even though we've had those couple clusters, persons have not been as sick. And initially, when we had all of these new cases in the last few weeks, the government are very transparent. We have press conferences on a regular basis where they allow us to know what's going on, where we're at, what the facility is holding, what kind of patients, if persons are on ventilators and such forth. They let the general public know this. Um, and they were up to that point, the persons that had gone in recently were all unvaccinated, we were only informed yesterday that there are now 10 persons that have COVID that are in isolation who are vaccinated. 6 are imported cases, 4 are local cases.
I mean, in a sense, that's not too surprising, really, because I think you've had nearly 100,000 people who've had the first dose of vaccine,
Yes.
and I think you're on about 75,000 who've had the second dose now. So actually, to only have 10 people so far identified that have been vaccinated is a pretty low number.
And 6 of which being imported. I think
Yeah.
that's an important thing to note because our borders are open. Obviously, since England got the green light, we have seen a significant rise in numbers of travellers, of tourists coming to the island, which we need as a population.
Of course.
But it's that fine balance, you know. But they did indicate that none of the persons that are vaccinated that have tested positive for COVID need oxygen therapy or any adjunct therapies at this point in time. They are stable.
That is excellent, isn't it? That's really
Very
good.
much so.
I'm just wondering if the sort of sun exposure and the vitamin D and the healthy atmosphere there, and perhaps contributes to that. I mean, have you any ideas on why the severity of the disease thankfully seems to be fairly low?
I don't, but what I would say is we do a lot of contact tracing over here.
Right.
Vigorous contact tracing. So some persons are diagnosed who didn't even know that they were sick. It's purely because they've been primary contacts.
Yeah.
And we have so many testing sites over here that you don't have to necessarily be a primary contact to be tested. If you are concerned, they will test you. So we actually do such vigorous contact tracing. I think we're able to get persons, and because we don't send people home, it's not like in other countries, they are then monitored. So the slightest change in something, we have that ability to respond.
And
so I think
early.
that being able to respond and treat early and look for any warning signs has, allowed us to, I mean, we've had 48 deaths. It's very sad, but comparatively to other places in the world and some of our other brother and sister Caribbean islands, we've had 48 deaths. And I think that that's commendable. And, we've had persons that really had significant underlying factors, heart disease, dialysis. And already as a population in Barbados, we have a high rate of non-communicable diseases, cardiovascular disease, hypertension, diabetes. They are massive factors for us.
All the classic risk factors, isn't it, for severe disease?
Absolutely.
Wow. And are there any particular therapeutics that are being used in Barbados, as far as you know, or is it just the sort of standard supportive treatment followed by steroids in the second week if people need that?
It's standard supportive treatments. So it seems to be working well.
Right. So basically, you're picking up everyone. It sounds like you're getting them at an early stage, and given that only such a percentage of people get very sick, it sounds like you're keeping that percentage well down. I mean, that is.
Yeah.
I mean, I don't think it's any great secret that the economy there is not as affluent as people would like it to be. So to have achieved that level of control on a remarkably low budget.
We're a very developed island, and I think the facilities that we have are extremely commendable. I mean, at the end of the day, it's very expensive to come here. It's expensive to live here, but we're still not a first world nation. But the facilities and medical facilities and the quality of the medical teams that we have here, I think speaks volumes. We have very, very qualified persons. We have fantastic departments over here within range of cardiovascular, neurology. We have a very good system both in the private and the public system.
And you have the full training facilities in the island as well, don't you? It's all.
Yes, we do. We have the University of the West Indies, the Cave Hill campus, the UWI is how we refer to the University of the West Indies, which has campuses throughout the Caribbean. But yes, we have a medical faculty. We also have overseas medical faculties offshore that come here. We have Ross University. There are 2 other American-based offshore universities that have their medical degree components here.
And I'm
I think
guessing I'm guessing that a lot of people who work in the state don't really object to spending a few weeks working in Barbados.
no,
Yeah,
no, not at all. They come a bit sunburned around on
yeah,
wards,
yeah,
on ward rounds, but
yeah. No, that's all good stuff. Right, what about vaccination, Amy? Have you made a start?
yeah, I mean, I think we've done very well. I was one of the first to take it up as soon as I could.
Sure.
We started off with AstraZeneca. That
Yeah.
was what we were able to obtain. Again, people have to remember we're an island. We don't have a choice, a massive choice of what we can get. You also have to look at our conditions. We are a hot, humid climate.
Mm,
Storage, shipping to us. I mean, England is 8.5 hours away. Just to, if anybody who's not familiar, so Barbados is in the West Indies. We are 4 hours, 4 or 5 hours away from areas of the United
mm,
States. I mean, it is a difficulty
yeah.
with shipping things.
Yep.
It's even more of a difficulty in these trying COVID times. I
Yeah.
mean, not just vaccines, getting simple everyday instruments and medications and supplies is very difficult, because if you think that when the countries, first world countries, were struggling to meet the demands, what
Yeah.
do you think
Yeah.
happened to poor little islands like us?
Yeah.
And then things were so expensive,
Yeah.
we had to battle that as well. But getting back to the vaccines, yes, we started off with AstraZeneca. That's what I have.
Yeah.
I'm fully vaccinated with AstraZeneca. And now we recently had a shipment of the Sinopharm. So that's
Yep.
the vaccine that's presently available on the island. So, yeah, we kind of get what we can.
And so we're getting to about a third of the whole population vaccinated now. So,
Yeah, I think it was somewhere
more
around
than that.
28%, something like
Yeah.
that. Heading
Yeah.
well on our way to 30% of the population.
That's fully vaccinated as well. So
Fully
that's yeah.
vaccinated. That I'm talking about fully vaccinated. Yes,
Yeah.
because if you look at our population being around 290,000, it's fluid, but then we
Yeah.
are also persons that are on the welcome stamp. We have something over here called the welcome stamp.
Yeah.
So it's a 12-month program. Persons can apply, um, and they have to prove that they're financially stable. I think the earnings have to be $100,000 per year to be able to come, and you have to be able to not seek work when you are here. You can employ persons, but you cannot seek work here. You have to be able to work remotely.
Right.
But then you get a 12-month, you're able to come for 12 months, and you can come and go as much as you want to in that time frame. So if you need to travel, you can travel, uh, obviously once the borders are open and your countries
Sure.
allow you to go back.
Yeah. Yeah.
But we've also been able to vaccinate those persons as well, so we can add that onto our population base,
And
because they're kind of a
that's an
temporary
income.
resident.
Yeah, it's an income source for the country as well, of course, isn't it?
It's actually created a lot of revenue, because you have to pay to have the application,
Yeah.
and you may get refused.
Sure.
It's only if you are then accepted, you then have a further fee. But
Mm.
they just announced last week, actually, that they are extending the welcome stamp program, because it was initially for 12 months. So they're now allowing persons to stay longer. So if they wish to renew it for another 12 months, then they can actually go ahead and do that. And there's many fantastic remarks coming about the welcome stamp program. I know some people that are here on the welcome stamp program. My children went to school with a couple people that actually came over with their family and were on the welcome stamp program from America, and they had a fantastic time.
I'm sure they did.
You
Yeah,
know,
yeah. So, this is quite impressive in terms of organisation, vaccination, despite severe financial difficulties. Now, you say you've moved on from the AstraZeneca to the Sinopharm. Am I right in thinking that your AstraZeneca was coming from India?
yes, it was. Yes.
Right, right, and of course they
And when we
stopped.
first got the initial first set of vaccines, we actually shared it with some of our brother sister Caribbean islands as well, because they're also having difficulty obtaining, and with their population base being even smaller,
Mm,
um, it would be even more difficult for them. So we kind of try and look after each other. As a Caribbean nation, we try and come together and help each other out when we can. Um,
mm.
you know,
No, that's good, and I'm really impressed by the contact tracing and
It's
the way that
very
people are.
rigorous.
I mean, it sounds like quite a discipline thing. So basically, it's mandated that if you test positive, you go off to
You have no choice.
this area. And are people accepting that, or is there demoting about it?
There was a couple people that had issues, but you have no choice.
Yeah, 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 yeah,
You will be removed
yeah,
from
yeah.
your home.
Right, yeah, yeah,
Um,
yeah,
I mean, they come to pick you up. You don't make
yeah,
your own way there.
yeah, yeah,
You are picked up by
yeah, yeah.
members of because the military are heavily involved in
Right,
this.
right, right, right.
It's very much a partnership. So they're helping to keep things organized. So persons will come, you will be picked up, and you will be taken whatever hour of the day, and you will be taken to the facility.
Yep. No, it sounds good. But the point is that the results are seen in the country. You know, you have controlled this pandemic better than, well, the vast majority of places in the world. From what you're saying is good.
I think our government, I mean, there is no right and there is no wrong. Nobody's going to get this perfect because it's such a fluid situation. And there's no
Correct.
model that anybody can run off because everybody's population is so diverse.
Yes.
And how can you do a model that can be replicated in areas? So I don't think anybody will have gotten their strategies correct. It's very hit and miss, but I do
Mm-hmm.
think that overall we're doing the best that we can and we're handling it very well.
What are the restrictions on your day-to-day activity at the moment, Amy? Do you wear masks in public places, or what's the situation?
Absolutely. It is compulsory mandated. Public places, you can't go into a store. Bars and restaurants are open. We are presently on a curfew from
Mm.
11 o'clock at night until 2 o'clock in the morning. Sorry, 5 o'clock in the morning. That was implemented when we got those recent new clusters with the spike in cases, and it was just renewed. It was to finish on Tuesday coming, the 27th, and it's just been renewed for a further 2 weeks,
Right. Okay.
with the aim that persons wouldn't be able to go, as we call it in Barbados, liming, otherwise known as gathering, getting together,
Yeah.
going to
Yeah.
a club,
Yeah.
and such forth.
Sort of
And they're very
rowdyism and
strict.
things. Yeah. 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 Yeah.
We're given
Yeah.
passes. You get a special pass. You have to apply. Your company applies for a pass, or if you're the company, you would apply. State your reasons why you need to have an exemption pass, and you would then be given it something that goes onto your phone. And if the police stop you and you're out on curfew, you would show them that you are entitled to be
Right.
out.
Right.
Now, I don't believe if you're dressed up to the nines because you've been out to the restaurant and you try and tell them you're coming home from work, I don't think that's going to work. But that the idea of the curfew is to try and limit persons that are gathering, and the police are
Yeah.
very much stopping people. If you are out and about, you will be stopped.
And of course, the local police know a lot of the local people anyway in Barbados, don't they? So
Very much so.
you wouldn't
Very
get it.
much
You wouldn't
so.
get away with very much. So that's.
No.
But I mean, that saved lives though. 48 deaths out of a population of 290,000 is
Plus
impressive.
visitors, plus visitors,
Plus
because some of
visitors,
those
yeah.
deaths
Right. Oh, okay. Right.
unfortunately were
Right. Right.
visitors as well. They were actually
Right.
visitors to the island that
Right.
unfortunately some came with COVID, some contracted COVID, but unfortunately, they perished
Yeah.
due to COVID here. But I think that's a
Yeah.
story all over.
But the overall numbers are. I mean, to use a phrase, as well as could be expected, I suppose, isn't it? Or better than could
Yeah.
be expected.
Yeah.
On a personal note, Amy, I've had the pleasure of meeting your family. How are Sean and the kids?
They are very good. For those that don't know, I have a very long suffering husband and I have a 12, soon to be 13-year-old twin. They're very quick to point out to me that they will soon be 13.
Already, wow! And they've been healthy. They haven't had anything.
Oh, they've been absolutely fine. I mean, I took every precaution that I possibly could.
Sure.
My husband works in construction, but at the
Yeah.
time he was working between a children's home and the hospital doing renovations. So he didn't get the lockdowns either. And we're fortunate to have a spare bathroom. It was literally, I got changed at work. I had a rinse off,
Yeah.
basic rinse off at work,
Yeah.
changed my clothes, came here, we stripped at the door, went into the spare
Yeah.
bathroom, and it
Yeah.
was like, children, you're not going in that bathroom.
Yeah. Yeah.
So, I mean, we've done everything that we can. When the first lockdown occurred, even when the lockdown was eased, my children did not leave home. I did not leave, they did not step foot out this house from the garden for 3 months solid.
Wow. Wow.
I took it very, very, very seriously.
Yeah.
and we've
but
been
again,
very fortunate.
they've been well, they've been healthy. It's worked. It's
Very healthy, very
yeah.
healthy. And my close friend base as well, we all took those precautions and everything, and thankfully none of us have contracted COVID. We've been very lucky. um all of my friends are vaccinated, fully vaccinated.
Yeah, yeah.
So my circle alone are fully vaccinated.
So has there
So
been an enthusiasm for the vaccine, or has there been vaccine hesitancy?
hit and miss. And now that we don't have the AstraZeneca, I will
Mm,
say there is an awful lot of reluctance. They're doing far more awareness now. The government are doing far more, I don't want to say marketing for lack of a better word, but
mm,
they're really doing some teaching
yeah,
regarding this particular vaccine that we have now. And
yeah.
but as they say, nothing else is coming at the minute. So,
That's right. Yeah,
you know,
you take what you can get. Absolutely. That's
Mhm.
so there's a lot of educational materials in the newspapers and on TV and on the radio and things
Very
like
much
that.
so.
Yeah.
Instagram. So we have a COVID Barbados page. So that has updates. The Ministry of Health. They have Instagram, Facebook. Everything is on there. We have something called the Government Information Service, GIS Barbados. And they have a Facebook page. They have an Instagram page. But they also are responsible for the press conferences, which
Mm,
the Minister of Health, Minister of Tourism, Education, the Prime Minister, they're all involved in it. And also the director of the isolation facilities, the COVID isolation facilities.
mm. So
All of
they're
this,
using mainstream media and social media. Yeah.
as well as it going into the daily newspaper as well,
Yes. Yes. Yeah.
because
Yeah.
obviously the newspaper over here is still extremely popular. Um,
Mm, yeah. Yeah.
Very much, some
Yeah.
people can't function if they can't get the
No.
newspaper.
No. That's
You
right.
have
Yeah.
people out and about selling the newspapers
Yeah. Yeah.
early in the morning.
That's the way it
Hmm.
should be. Absolutely. Yeah. 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 Now, what about your work, Amy? I mean, you're working in cardiology and radiology, so you're doing interventional cardiology.
Yes, I am.
So you do things
Yes.
like
So,
stents for things.
hmm
So
and
has
because
your
we
work
do
been? Sorry, has your work been impacted?
Um, well, we've still been busy.
Yeah.
We don't just do private. I work in private, but we don't just do private cases. We also do public cases from the hospital
Yeah.
because we have the facilities and the ability
Yeah.
to provide services that the hospital may not always be able to
Yeah.
provide. Um, and yes, it's been very busy. We haven't really had to deal with COVID cases.
Yeah.
There's been some that are questionable. We have chronic patients. We
Yeah.
have patients that come
Exactly.
in routinely in heart failure. If they
Exactly.
were to
Yeah.
tick the boxes,
Yeah.
they're going to tick all the boxes.
Yeah. Yeah.
The only thing they might be missing is the fever, but everything
Yeah.
else, they're
Yeah.
going to be ticking the boxes,
Yeah. Yeah.
So we have to have that fine balance.
Mm.
So it's been difficult, but we have PPE. My facility has not had a shortage in providing the equipment and resources that we need to keep ourselves and our patients safe.
Now, it's great you can keep going because you probably know in the UK, I can't remember the figure. There's about 3 million patients waiting for treatment. It's been
Yeah.
such an imposition on things like cardiology treatments, varicose veins, joint replacements.
Yeah.
All cancer work has been greatly impacted. So there's going to
Well,
be a
we
lot
were
of
impacted because obviously we have to source our treatments from overseas. They have to come from overseas. We're an
yeah, yeah,
island,
yeah,
so
yeah,
it's been
yeah.
it's severely impacted us as well.
Mm,
But because of our issues with cardiovascular disease and such forth over here, it was important to still keep going with our program as well, because we've been even worse problems. But again, getting the supplies has been difficult. I mean, we don't have a limitless supply on the island, an unlimitless supply on the
mm,
island,
mm, mm.
because how do you house so many stents and balloons and sheaths and everything? Is very difficult. And then when you're shipping them in, one, there's the lack of supply coming from overseas, and two,
Yeah,
when the planes are not flying as often, you
yeah,
can't get the supplies in. It's simple basic
yeah,
things that then
yeah,
impact
yeah, yeah.
us.
So people have suffered as a result of that
Oh
logistical.
yeah,
Yeah,
for sure. And also,
yeah.
there may be some persons that go overseas for treatment.
Mm, mm.
So, for things that aren't available here, and then they have to go overseas for treatment, they haven't been able to go.
Right.
So, again, that's it's caused an impact as
Yeah.
well.
So whereas in the UK the impact has been primarily that nurses and doctors who would have been looking after other patients have been looking after COVID patients, there the impact is largely logistical and supply of the equipment that's required to look after your
Absolutely.
patients.
Absolutely.
So a slightly different,
Absolutely.
yeah, slightly different condition. Yeah. I mean, that's a fascinating insight into the COVID pandemic actually in Barbados. Thank you for that. Now I've heard a rumor you've joined the army. This isn't true, is it?
Very much is.
No,
It's what you
tell us
do
about
when you.
tell us about it.
So basically, when I was in England, I was involved in the Cadet Corps.
Yeah.
Very good. I thought naively that it might be similar over here. Um, in 2019, my children joined the Cadet Corps.
Yeah.
Because over here it's attached to schools, but they also have an independent company. So my children joined the Cadet Corps. And when we went to orientation, one of the captains said how they were really looking to recruit new officers because one of the drives of our Prime Minister, she is wanting more cadets, more young adults, young people to be involved in the Cadet Corps.
Yeah.
She also wants to expand our Sea Cadet Corps
Right.
because
Well,
it's
yeah,
relatively small.
makes sense. Yeah. Yeah.
Right.
Mm-hmm.
So it's a very so they put a lot of money into this for the supplies to be able to do this. So they need more officers now. So I thought it would be a wonderful idea to join as a commission officer.
Wow.
So I didn't actually realize all that it would entail. And I
Yeah.
also didn't realize that it's run differently over here because the Cadet Corps is a direct arm of the Barbados Defence Force, which is our military force.
Right.
So when I go as an officer, I am actually a reserve officer in the Barbados Defence Force. And then the Chief of Staff will assign you to where you are best utilized, which may or may not be the Cadet Corps. They do have a medical cadet corps wing as well. We have a band wing, we have a cadet a medical corps, we have the regular infantry, we have the sea cadets. So I am awaiting placement, so we'll see, because I started my training January of 2020 before everything kicked off with COVID.
This is as well as
And
your
the
day
old
job, of course.
Yes, this is as well as working full time. I just decided, hey, you've got weekends, off you go.
Well, you've got the
So I'm actually
expertise, I'm
the
sure.
oldest female on the course that completed the course. I was like the mummy to the others, because I mean, there I was when I started, I was 38. Now I'm 40. So yeah, some of them were only like 18 and 19, but I
Wow.
made it. The old dear made it through the training.
Well done. You know, there's quite a few of my former students I'd have to call doctor, sir, ma'am, various things like that now if I was in
But
that
on the other
position. So
side,
well done, ma'am. That's fantastic.
But on the other side, they also have something over here
Yeah.
called the field medical facility. So
Yeah.
you don't actually have to be in the military to be involved with it, but I am involved with it through my involvement with the Barbados Defence Force. So the field medical facility is a facility in itself. We are actually certified as a Type 1 facility. What that means is it can work as an outpatient facility. This is something that it's not just for Barbados. If our brother, sister Caribbean islands had a disaster and we need to be deployed, we have all our equipment, the tents, we have monthly training that we have to work together as a team to go through different things, different scenarios and such forth, learn all the protocols and strategies. And basically we can be deployed at a moment's notice, and we are self-sufficient, and over we go to another island. We were on standby when La Soufrière in St. Vincent, when it erupted a few months ago. Yeah, so I'm sure persons may have heard about that. And we had clouds of ash billowing. So we were on standby to go, but fortunately we did not have to be deployed. We are actually seeking our Type 2 certification, which is, I was taken on board for that to head up the recovery room and high dependency unit, because the Type 2 actually turns it into a hospital overnight facility with 40 beds.
And a surgical facility.
Yeah, it has two fully functioning operating theatres. It has the high dependency recovery room is in one tent, 4 beds and 3 beds allocated to those areas. It makes sense because persons may suddenly go from being a recovery room patient and going back to the ward to suddenly needing more of a high dependency unit type care.
So you could be
So
deployed as a whole unit, just plonk, and then you've got this functional facility there on another island.
yes, and we work together as a team so that we all know, and we do
Yeah,
many training sessions.
yeah,
And you familiarize yourself with your equipment so
sure,
that you already
sure,
know how to use your ventilator, your suction machine, your various ECG machines, monitors, etc.
sure.
And as I say, you don't actually have to be in the military to be
To
involved
be
with that.
involved in that, yeah,
It's a
yeah.
voluntary. It's a it's
Mm,
a voluntary facility. You're
yeah.
not paid to
Mm,
be in it.
mm.
But it's
And of
very,
course,
very worthwhile.
oh yeah, and of course the hurricane situation there. I mean,
Hmm.
that
We
could be
just
another.
went through we just went through a hurricane a
Mm,
month or so ago. Hurricane Elsa, when it hit
yeah,
land here,
yeah.
it was a hurricane.
It's pretty frightening.
So
Pretty frightening, is it?
it can be.
I
Yeah, I
can
mean, when
imagine.
those
Yeah,
when those winds are gusting, thankfully Elsa didn't bring an awful lot of rain. We
yeah,
would have been in
yeah,
a far worse position.
yeah,
I mean, I was without electricity for 5 days, was without water for 4 days. It was it
yeah.
was the worst that I've been through since I've been here in terms of loss of amenities. Uh, but we were fortunate that we've made it through well as an island. The
Mm.
government are helping persons that have lost their homes due to the winds were high. I've lost my banana trees. Everything
Oh
just
no.
bent. It
Right.
was
Yeah, yeah.
quite, it was, you see garbage cans just flying down the street that were actually secured. They broke their
Yeah,
moorings and off they've
yeah,
gone.
yeah.
So, but
Yeah.
other
So
islands have had it far worse. So that's when we, as a field medical facility, would then be
you
deployed
could be deployed
to be
to.
able to take. I mean,
Mm,
if the hospital gets damaged, what are they supposed to do?
sure.
So,
No, that's it's just so wonderful to. I mean, you've done all this on your own, but it's pretty wonderful seeing former students doing such useful work and impressive things.
not
It's
such a crazy idea to move to Barbados 18 years ago now,
yeah,
huh?
yeah, yeah. But it's worked out for you. It's brilliant. You've got your family there. It's you got your work there. You're making a real contribution though to the island. I mean, that's maybe the
I
main
would never
thing.
move back. I would never
Yeah,
move back to England
yeah, yeah.
because my life is here and I
Sure,
feel very fulfilled with what I do. I mean, we all get
sure,
stressed with work. There's days you go into work just banging your head against a brick wall,
sure.
but for various reasons. I
Yeah,
remember when I was working at the Cumberland Infirmary in
yeah, yeah,
Carlisle
yeah,
and I had just a regular normal saline infusion to give and I was frustrated because I didn't have an IV pump, and you were
mm,
frustrated because you
mm,
didn't have one just for a simple
mm.
normal saline infusion. Over here, some of the wards, you're lucky if they even own an infusion pump,
Yeah,
and you have potassium going. They
yeah,
have these little plastic things called a dial-a-flow, which
yep,
I'd never even heard of
yep,
until
yep,
I moved to
yep, yep,
Barbados.
yep,
You
yep.
learn to be resourceful.
Hmm.
You have to, there's no waste. There's no
Yeah.
waste. You learn to look after what you have
The,
because
the
you,
amount of waste in UK hospitals now is horrendous. I was working on A&E a couple of years ago, and the amount of plastic waste is buckets loads of it. It's terrible.
I think I would struggle. I think I would
Yeah,
struggle if I came back to
yeah,
England because I would not be used to the wastage,
yeah,
to
yeah,
not being
yeah,
able to say, okay, well, I've drawn this up with a clean needle. We'll just put this value, put the date of when you open something so
yeah,
that you
yeah,
know if
yeah.
it's still viable to use in a few days, or you draw it up, put it in the fridge, label. I mean, you would be very surprised.
Yeah. But
And
but
for me, I've learned a lot, and I think it's a lot in the positive.
but because you understand the principles of things like infection control and the principles of this,
Yeah,
you're able to implement safe interventions
exactly,
at
exactly. That's
a
exactly it.
much lower cost.
Yes.
Yeah.
Yes, and we actually have infection control specialists on the island.
Mm,
One of which, Dr. Corey Ford, is very involved with the whole COVID,
mm,
um,
mm,
with the whole COVID pandemic.
mm.
He's been overseas. He's done his training. He's a Barbadian doctor.
Yeah.
Went overseas to do his training and
Yeah.
everything in the infection control, and everything has come back. And he's got a team, and I think it speaks volumes. We have protocols in place.
Mm.
So
Plenty to teach the rest of us, Amy. That is for sure. That's for sure. But for today, thank you for that. Great insight. Great to talk to you again. Love to Sean and the
Thank
kids, of
you.
course. And you can keep us informed if anything else interesting comes up, if you don't mind. That's tremendous.
Sure,
Okay.
absolutely. And if anybody ever has a desire to want to know more about working in Barbados, you can let us know and we can forward any information. It's a great place to be. 18 years later, I'm still very happy.
Hope I get back one day. Yeah.
Yes,
Great.
me
Yeah.
too.
Yeah. Thanks, Amy.
All right.
Thanks. Thanks.
Thanks a lot. Take
Thanks.
care.
Thanks. You too. Bye. Bye.
Bye bye.
Bye.